Good day, this is Dr. James Fortuin, another session of the ECG of the week. Today we'll look at a very interesting ECG that was taken on a lady in her 30s that presented with chest discomfort, very large cardiothoracic index on X-ray, and this ECG at first glance actually looks very normal. Patient has sinus rhythm, normal axis, normal R-wave progression, and no real changes in the ST segment or QT interval. But if we look closer at V1, we see the beat-to-beat variation of the QRS complex amplitude. If we draw a line through the largest QRS segments, one can see that this beat-to-beat variation is more obvious. This feature on an ECG is called electrical alternans. Here's the X-ray that the peripheral hospital took, and they were worried that she either has a pericardial effusion or just a very, very large heart. Her heart sonar revealed that she had a large pericardial effusion, and this turned out to be tuberculosis. Electrical alternans is a feature that we see on ECGs of patients with pericardial effusions, but there's also other conditions that can give you this. So remember this differential diagnosis if you see electrical alternans next time. Sinus tachycardia, other supraventricular tachycardias, ventricular tachycardia, and even Wolff-Parkinson-White. Why do patients get electrical alternans? There's this motion-related subtype, which is the cyclic beat-to-beat shift in the QRS amplitude because of the heart swinging in a large amount of fluid in the pericardial sac. There's also an electrical subtype, and the reason for that is that there's alternation in the conduction on a beat-to-beat basis. If we think of ventricular tachycardia, sinus tachycardia, and even Wolff-Parkinson-White. I used this article as a reference when reading up on electrical alternans, and I like what the title says. It's a sign and not a diagnosis. So if we see this, we should look a little bit further and see what the patient's problem really is. So the learning point on this ECG for me is that electrical alternans has a differential diagnosis that one must quickly think about when we see this feature on an ECG. Thank you for your attention. Until next time, goodbye.